Is asking if a lady can get pregnant during her
periods.
Her
yes.
periods.
She's worried the lady's just
based on the physiology that we know, that shouldn't happen because the environment in the womb is unfavorable for the sperms to pass through. That shouldn't happen. But sometimes people confuse periods with some other condition called implantation bleeding.
Okay.
Yeah. So if in a situation where somebody is where people are having repeated sexual encounters, the cervix and even the tube, even the womb stores sperms a bit, and so it goes ahead and fertilizes and causes implantation, and then gets implantation bleeding. Pregnancy is occurring, but there's some spotting because of the way the baby is attaching itself. Sometimes this can be so significant that it is of concern, but the actual period should not allow a pregnancy to occur.
Okay.
Yeah, but sometimes it's confused with implantation bleeding.
Thank you so much, Dr. Emma. I think you've got your answer right. Doctor is saying pregnancy does not take place when someone is in their periods. It's always after or before, towards ovulation. Yes, so please take time and discuss it with your partner. You see how best you can plan, but she cannot conceive during her periods. We have a question here, Doctor. She's saying, good evening, thanks for the good work you're doing. My question is, what causes molar pregnancy? This is a very big question and a topic of its own to discuss, but briefly, since she's our follower.
Yes, so so we can actually answer that one a bit. First of all, what a molar pregnancy is. Yes, so what happens is usually in the normal, it's one of the abnormal forms of pregnancy. Yes, so usually when fertilization occurs, that is the egg gets to meet the sperm, that is the egg gets fertilized by the sperm. That marks the beginning of the life of an individual. This happens in the tube. And so this is one cell created from two half cells, literally. And so this is the real human being actually, but one cell. And it starts dividing into more cells and more cells. And as you get more cells, they now model themselves into a human being. So these cells start differentiating. Others become muscles, others become bones, cells of the bones, others become the eye, others become the nerves. And so eventually the human body takes shape. Now, and then some of the cells become placenta and the covering membranes. Now, if you get problems with this differentiation, sometimes the differentiation takes the form of grapes. Instead of the cells taking the shape of human beings, they take shape of small cysts, and that's what's called molar pregnancy. It's an abnormal differentiated form of pregnancy. Now, based on the genetic analysis of these molar pregnancies, we know that there are certain causes of molar pregnancy. For example, one sperm is supposed to enter one egg. Yes. Sometimes two sperms enter one egg. Now, in that case, the genetic material is not balanced. There's twice the size of the amount of the genetic material from the sperm now. Two sperms going in, that means they are bringing two sets. And so the differentiation of such a pregnancy will not be normal. So more sperms entering into one egg is one of the causes of molar pregnancy. Sometimes it is one sperm which was not formed very well. It has double the genetic material, and so it causes molar pregnancy to come. Yes, but in some cases we do not know the cause. What is not very clear is the risk factor for abnormal formation or behavior of the sperms. Sometimes it is age-related, sometimes it is some other factors which are not yet known.
Thank you so much, Doctor. We still have other questions, but we can answer them as we go along. Do we have another call on the line? Okay, I think we lost him. There is another question here. This is still, I think, Rema saying, yes, Doctor, thanks for your reaction to my question. How can I go about to overcome that problem of fibroids? I think I'm going to ask this question again. There's someone on the line. Medical Minds, hello.
Hello.
Hello. Good evening, Doctor is listening to you. Who is calling? Where are you calling from? Okay, can you be switch off your TV set? We can't hear you well.
We're getting echoes. Maybe they move.
Or you can extend away from your television set.
Okay, getting. Doctor, you see, what you are doing is up.
We are losing you, my dear. You're so close to your TV set.
No, the thing, I don't know how I can explain it. What you have explained, what to do.
The line is
the line is being disrupted, my dear.
Maybe the TV.
Please, just in case you're making any call, dear our viewer, just make sure you're away from your TV set, or you switch it off. Give us your call, then you switch it back as you listen to the response to the doctor. I was still reading for you another comment, doctor. She's saying this is kindly talk about how she can overcome the problem. I think this is the same thing that you've answered here. This is the same person. She's again asking about contraceptives and fibroids. I think it's still a very lengthy topic to discuss.
Yeah, so she's asking, what is she asking specifically about contraceptives?
The relationship between contraceptives and fibroids.
Yes.
Some women think that taking contraceptives or family planning causes fibroids.
Yes. Really, actually, the truth is, okay, we have different types of contraceptives. There are those which are non-hormonal, which don't have hormones in them. Those ones, I think most people don't have any worries about them in relation to fibroids. I think they are concerned about the ones where there are some hormones.
Okay.
Because we know that we always tell people that it is the high levels of the estrogen, which estrogen or progesterone, which are related to the fibroids. Now, the effect of the regular use of contraceptives on fibroids is quite negligible. The blood concentrations of the estrogens and progesterone, which are caused by the contraceptives, are so low that they cannot cause for you fibroids. They cannot be implicated in because you need very high levels of these estrogens to be able to have issues with fibroids. Yeah, so technically we are not worried about that.
Okay.
Yes.
Thank you so much. This is Cosmas Opera is saying, thanks so much, doctor, for the show. I think he's enjoying and watching with the family members. Thanks so much, Cosmas. We have a question. There is a question, I think, we didn't react to. Hello, Bethan TV. Thank you for your program. Very educative. My name is Eunice from Chitende. Can we have the contact for Dr. Gonzaga? No worry. You can get him at the clinic. Just in case you want to really talk to him, you can find him at Luzira, Bethana Women Hospital. You can find him there. And there is another question here coming up. Hello, I am Dr. Paul. The name is a little complicated. Pookie, something like that. I wanted to ask, are routine fibroids linked to face acne? Routine fibroids. Uterine? I think
fibroids.
It's uterine. Yes, I think it's the way he wrote it. It's uterine fibroids, yes.
Yes. So
linked to face acne?
We can ask that. We can answer that one.
Okay.
The answer is no. Okay. No direct. Fibroids don't cause acne. But both fibroids and acne are conditions which are exacerbated or are both can result from high levels of hormones. So they have the same risk factors. Yes, for example, the estrogens, progesterone, they always go together with the high levels of the testosterone hormones. Okay. So those are responsible for the acne people get, especially the progesterone, because progesterone has the androgen sort of effects. The androgens are male hormones. Testosterone is one of them. Those are related to acne. Yes. But also progesterone and estrogen on the other side increase the risk of high levels of them increase the risk of developing fibroids. So that's why you find you'll find fibroids in people who are fat, more common in people who are fat. These are the people who are more likely to have acne, and all that is because of the underlying hormone issues.
The hormone imbalance there.
The hormone imbalance, and most especially higher levels of these steroid hormones.
Thank you so much, Doctor.
Yes.
We have a few questions still coming in. Hello, please. I'm a breastfeeding mother. My baby is 6 months old, and I'm in family planning using injections of 3 months. But I haven't seen my periods tested for pregnancy. I'm not pregnant. What could it be?
Oh, yeah. So the injectable contraceptive has progesterone.
Oh.
Yeah, so progesterone, when you take it in the depot form and in a higher dose, it can actually take away your periods by switching off the influence of the brain on the reproductive system, but also by thinning the lining of the womb. And so if these two act together, and especially if the levels are still high, that is most likely the effect. So we call it amenorrhea related to contraception.
Okay.
Yeah, so it's okay. It's not to worry. It's one of the things.